Welcome, everybody. We are really excited to have Worcester Safety Council up and running again, even though we're virtual. But welcome to our first meeting. Kelly Ott is here with us to share some ergonomic risk factors and for anybody that's working from home or has employees working from home, some tips to help keep them comfortable and safe while they are out of the office. So I will turn it over to her and she'll give you the latest BWC updates and go into her presentation for today.
All righty.
Screen shared here. Coming up.
There we go. And maybe if you can click the little at the very bottom, it looks like a pull down screen that will put it in one mode there. There we go. Perfect. Thank you. So thank you. All right. Well, welcome everyone. Whoops. I think we need to go back to the first slide there.
Oh, sorry about that.
No worries.
Go back. There we go.
There we go. Welcome. My name is Kelly Ott. For those of you not familiar with me, I'm with the Ohio Bureau of Workers' Compensation. We help sponsor the safety councils. Just for FY, we call it our fiscal year 22. Our fiscal year runs from July to July. And meetings are still conducted virtually. Again, probably just to try and keep everyone safe. The rebate programs do remain suspended. We are not requiring a CEO attendance, and we are not requiring the semi-annual reports. So next slide. We are offering webinars, and in September of this year, we're going to offer, whoops, that's okay. It's on here too. Maybe it's on an auto. I'm not sure. Is it on an auto play?
Oh, maybe it is because I did not do that.
Oh, all right. All right. So let's see. Maybe we do want to go back to the original if it's going to auto. Sometimes it auto forwards. So bear with us, everyone. We're still in our learning curve of how to forward on our slides. So on September 14th from 10 to 12, if you're interested, we are offering a webinar. You can access those. I'll show you on the next slide at our BWC Learning Center or from our webpage. And the topic in September is going to be, so you've had a claim, now what? And actually, from my perspective, I wish we didn't have claims, but in case you do, this kind of covers what you need to do and how you should be managing your claims. So next slide. We also, again, here is that website for reference at www.learningcenter.com. We do offer virtual training, some of it even all day or half days. So starting August 30th, there's electrical safety in the workplace. We are offering violence in the workplace in September 8th. That is a half day. There's that webinar I mentioned. So you had a claim. Again, training, emergency preparedness, health hazards and toxicology, hazardous waste and accident analysis for half a day. Okay, next slide. We also have put together during this time some little micro training videos. The micro training are they're very short snippets. You can access those. They're little YouTube videos. I can put out the link to those if you're interested. I'll put that in the chat. And what you can do is you can maybe send these out on a smartphone, and they're like 1 to 3 to 5 minutes long. So if you want to, talk to your employees, for instance, on safety on steps, we have seen, by the way, an increase in the number of falls, especially on steps, because people might be wearing masks and their glasses were fogging up. So maybe you want to remind them, be careful. Maybe you need some anti-fogging wipes. Maybe when you're going on the stairs, do you need to remove your glasses if you're wearing a mask? Because these can result in some pretty bad injuries if you fall on steps. HASCOM, we've got little micro training videos that you can send out on what's the safety data sheet, how do you read labeling, and this is to help. We're trying to help employers do these in little short bursts. Okay, next slide. And if you're looking for a safety talk, something that you could pass out, we've made these one page. And also, okay. And then things like falls, parking lot safety, flame resistant clothing if you're working with electricians, burns, slip, trips, and falls. And next slide. And I think you might have to hit it twice so it doesn't keep forwarding. We also have written programs. So OSHA requires you, for instance, to have written programs. Maybe HASCOM, protective equipment, especially with COVID. So here are some basic templates, and you put in your site-specific information. We have these available already pre-written to help you out. Okay, next slide. I wanted to go over just for this month. It's very hot. Be careful. Watch your employees. There is a heat stress that you need to be aware of. I worked in manufacturing, whether you're outside or inside, just watch for symptoms, especially people who may be predisposed to elevated temperatures. Watch for headaches, nausea, provide them with cool water, and especially if they get hot, dry skin, that one in the center, that's an indicator that they may have heat stroke, and you really need to get them medical attention and get them cooled down quickly. Okay, next slide. And from BWC, this was my little have a wonderful summer. Again, watch for heat. But I put this in here, okay, for young workers. I'm sorry, just because we've seen an increase, just to make you aware of young workers being injured. We have a lot of new people coming to the workforce. And I was going to suggest, can you give them a mentor, a buddy, someone who kind of, as they come in, kind of coaches them, maybe invite them to your safety committees, have them learn how to do an inspection, so you make them more aware of what to look for and how to, prevent those injuries. All right, next slide. Okay, and so I'm going to hop into the slide. I offered to do your first presentation, just so you know about me. Again, I focus on ergonomics. I'm a certified safety professional and also certified health safety professional. And as COVID started, and I don't know if you're like, maybe me, I'm still 18 months into it at home. I want to give you some tips on how to reduce those risk factors and ergonomics while you're working at home. All right, next slide. Again, many people may have a new office environment. Maybe you don't have that as many, maybe a standing desk like you did before, or an office chair. Children, and this is an interesting transition right now, maybe doing school from home. Maybe they're returning to school. I know this week, several different districts I'm involved with are returning to school with masking, but maybe you're doing homework from home. And there could be some differences in the interruptions, what kind of furniture you have, lighting. So I want to give you some tips and talk about some of these things and how to recognize them and what to do. Okay, next slide. Okay, so you're at home. Yep, these may be your new interruptions that you didn't have before. Maybe you have young children, maybe you have pets. So keep that in mind. When you're doing videos, I had to let my cat in before this one. So just again, it's a little bit different than maybe what you had before. Next slide. This is a big difference I see is the furniture, what you're working with. Maybe you're sitting in a folding chair that doesn't have real good back support. Again, maybe we're holding something we weren't before. We're bent over, this person writing. Now you're bent forward. Maybe you have this really slick blue and pink kitchen with the really wonderful adaptable, chairs that are not really designed to give you, again, good back or leg support. Maybe you've got your feet up, or maybe if you're like, I've got older kids, they're working in the bedroom. So these are differences and can cause some issues if we're doing these for a long period of time. Next slide. And lighting, lighting again in the home office often can be different. Or maybe we're really looking at that monitor all day long, causing eye strain. If you are doing hybrid, or if you're doing a lot of meetings, if you're doing a lot of work up close, but I'm going to talk a little bit about this is what I want you to look for. These are low lighting or too much lighting. And we're going to talk about some things we can do to reduce that eye strain. Next slide. And also, this is my favorite when the person during a virtual meeting is in front of a window. Causes a lot of eye strain for for the people you're taught, who are in your meeting. You're kind of that camera on your laptop or tablet, phone is going to seek out the greatest light, and it's going to put you kind of in a dark position. Maybe you want to be hiding there. I'm not sure, but it's really better if we can kind of see you, and we try to avoid getting that big contrast. It causes a lot of eye strain for the other people in your meetings. Next slide. So what are some of the risks? With any ergonomics, I always look for something called awkward postures. And especially in the office or when we're working at our desks, things like your wrist, your neck, lower back, and shoulders are where we tend to see these awkward postures. And I'll show you some pictures. Again, that lighting or eye strain. And repetition is also something, and normally with ergonomics, we think of like somebody repeatedly picking something up or grasping or moving. But in the office, it's more a lack of movement. We're kind of sitting in a position for a long period of time. Your muscles are still working. Maybe your heart rate isn't as high. So those muscles get fatigued. They get tired because they're not moving as frequently. So that can lead to pain, to stiffness, and possible what we call muscular skeletal injury. Okay, next slide. So what is a muscular skeletal injury? That's usually your body's soft tissues. So where those muscles, your tendons and ligaments connect those different joints, and it's caused over time by work activities. And like I said, what we have to watch for in the office is that this work is being done statically. And I want to kind of also, usually they lead to what we call a strain or a sprain. Well, what's the difference? A strain is where your muscle is injured. So, that's usually due to a weight. Maybe you're doing weightlifting while you're watching my webinar. I have to admit, I do some light weightlifting sometimes, but if you put that strain, it's usually the muscle, and it's usually due to overuse. Maybe with that mouse, that could be where that could happen. If you've got your arm held out and that muscle's working. A sprain is more where the ligament, that connection between your muscle and the bone, gets hurt. And I think of maybe like you stand up from sitting and you roll your ankle. That's where you can sprain that ligament. The difference, again, is muscle and ligament. But ligaments, if you look at an anatomical picture, a ligament is usually white, whereas the muscle is usually red. Well, why is that important? Well, because those ligaments being white don't have as much blood flow. And when we do get a sprain, it usually takes longer to recover because you don't have as much blood flow going to those ligaments as you do with a muscle. Okay, next slide. So what are we looking for? Risks. Something I try to observe or maybe want to make you aware of is what we call extension or flexion, when my wrist is bent really upwards or when it's flexed down. Why is that important? Because anytime you've got like that V or that bend between those joints, we're compressing those nerves, we're compressing those blood vessels, those small capillaries. That's when, and especially if it's pressed against a hard surface, I'll show that in a minute. That's where we get injuries occurring, especially if I'm holding those in those static posture. If I'm typing, and I've got my wrist upward or I've got it bent down, and I hold that for 60 minutes, couple hours, couple days, months. That's where we can injure those joint flex points. And on the right, it's showing you how your thumb going up and down, maybe mousing, or if you're using a roller ball and you've got your hand up or down in an awkward posture, that can lead to some injuries. Next slide. So again, what's happening with my wrist? Do I have it bent and kind of pressed against a hard surface? That's where we can, then we get swelling and we're bending. Or do I have to the right? Remember we talked about that thumb and that deviation. If I've got my wrist bent kind of like in an awkward posture all day, we want instead our wrist to go forward and kind of straight and be not bent. Okay, next slide. So what do we want to be doing? We want our arms kind of parallel to our side. We want a slight bend, almost about 90 with our elbows, and then reaching across with straight wrists onto the keyboard. So again, that wrist isn't bent up, it's not bent down. Our elbows kind of at our side in a nice posture. This is our goal, and this is what we're trying to achieve. Next slide. This is what we're not trying to achieve. We don't want to be bent forward, compressing our internal organs, putting a lot of pressure on those neck and our forehead. So we don't want to be bent forward with a little tablet or laptop. And I'll show you some ways to get around having that, some very easy tips to avoid being in these postures. Next slide. Again, neck, be careful of your neck. If it's bent forward 20 degrees or sideways, if you're looking downward at your keyboard or down at paper, again, but that static, you're doing that day in and day out, that can lead to a lot of neck strain. Next slide. Here's some examples. This is me holding my cell phone sideways with my shoulder elevated or looking down at paper. Or if you remember back in the day, if you still have a corded phone, holding that kind of again, so your shoulder and your neck are not in good postures. Next slide. And then now, I don't know if anybody's aware, there's a new term. This is actually a medical condition called text neck. So what's happening here? Well, when you're standing, if you start from the left and go right, when you're standing, just holding your phone, kind of reading it, your head itself puts actually 13 to 12 pounds of pressure. We don't have an angle going, but actually already has 13 to 12 pounds just from the weight of your head resting on your shoulders. But as you move forward, like 10 degrees, that slight bend at the neck and shoulder now puts 27 pounds of pressure on your neck. And then as it bends forward to 30 degrees, you put 40 pounds of pressure. And I don't know about you, but I think about, again, I'm going to go back to my cat analogy or dogs. If you think about a 40-pound bag of dog food or 40 pounds of cat litter, that's how much pressure is on those vertebrae. And then as you lean forward even more, it's 49 to almost 60 pounds. So that's a lot of pressure being put on that joint as you bend forward. And especially if you're, especially, now when you're walking down the street and you see everybody bent forward, think about how many pounds of pressure is happening on your neck while you're doing that. So it's, again, good idea to take a break, not look, at your phone all day. Okay, so also some things to look at. These are what we don't want. Again, sitting in your chair with your neck sideways. I know this monitor is kind of old fashioned, but again, maybe too far away. Your arm, this is something I see a lot. If you've got that mouse way out to the right or to the left, if you're left-handed, and you've got that causes a lot of strain on your shoulders. Back is not supported, feet not on the floor. Is your chair too far back and actually pressing in the middle of your thigh? Something I coach people is to take your hand, put it behind your knee, and that's how much width you want between the edge of your chair and your knee. You don't want your chair all the way against your knee. That causes pressure, but you also don't want it halfway back against your thigh. You want about one hand width open there. Lamps way off causing problems. So again, this is kind of what we don't want happening. Next slide. So what do we want? I think we have to hit it a couple of times. Ears over your shoulders with your head facing forward. Upper back slightly reclined, shoulders relaxed, elbows comfortable at our sides. Forearms and wrists neutral. We've got a little soft rest, and your low back slightly arched. So, and thighs horizontal with our feet flat on the floor. So this is, and something about your monitor, if you hold your arm out, it should be about, your monitor should be about the end of your tip of your fingers. This is how far back it should be. Actually, you should tilt it slightly backwards. And the top of your monitor should be about where your eye level is. Next page. Okay, so here again, sitting upright, kind of with our laptop back, not pitched forward. Or again, sometimes it's okay to lean back a little bit as long as we've got a chair and kind of keeping, again, our elbow at a 90-degree, keeping our paperwork. And I've got some suggestions on how to keep that upright, keeping your eye in the top of your monitor about level, and feet flat on the floor. Okay, the chair. This is a gaming chair for people who want to get something a little, little fancy. Maybe we're sitting at our kitchen table, or maybe we've got not exactly the high-end office chair. Next page. Or these are I found highly don't recommend uncomfortable chairs. For a whole $193.99, you can get this cool Pepto-Bismol, somehow covered exercise ball chair. Do not recommend. I don't know what this is in the center. I found this, looks kind of spiky. And then somebody took, I guess, radiators. These are like highly not recommended chairs. Next page. Okay, so what do we want? Okay, suppose my chair is not really, super adjustable. You could put a cushion. You could fold a blanket just to sit on. Maybe take your empty boxes from your home deliveries and put that under your feet, or a phone book if you're not using those. If you've got some sturdy books, put them up on the table to get that laptop and that monitor up higher. I actually suggest, we don't really show it here, but getting a keyboard with a USB that's separate if you're having to use a laptop, so you can keep, your elbows straight. Again, looking forward, shoulders relaxed. Again, this is what we're trying to kind of achieve here. Next slide. Also be careful that, again, that you're not like your thighs are not pressed up against the bottom of the table, or that the edge of the chair isn't hitting the back of your knee. So how can we achieve this? These are just some examples that I've seen. Again, maybe you can get a little lumbar support on your chair. Boxes. Put your laptop up on a box, and here's that USB cord to a keyboard on the left, so that we've got a good height. Here's a little getting that paperwork up right. I'll show you a couple other tricks on that. Again, in the middle, we've got our feet. We've got some books so that if our feet aren't dangling, using a box to get that laptop and the keyboard separate. And similarly, also taking a towel, you could roll it up and try and put it behind your back to give you some lumbar support, and using those books to get your laptop up off the floor. Okay, so again, repeated static. If I'm sitting for an extended period of time, also sitting for extended is related to high blood pressure, not giving you as much of a metabolic rate, and lower and reduced blood flow. If you're standing, we recommend you stand on a soft mat. You could even maybe get like a soft kitchen mat. Try marching in place, do leg lifts, but please hold on to something for stability. I don't want you falling, and sit, again, we really recommend that you kind of go do both, sit and stand. I'm going to show you some tips for that, and make sure it's important to move. And I'll give you some suggestions next on that. Okay, so if you're sitting, we actually recommend a minimum of once an hour to get up and walk for at least 5 minutes. Moving every 20 to 30 minutes is even better. Just even like standing up, hold on to something. If you are sitting during virtual meetings, try standing. If you're talking on your phone, try walking, trying to change postures, trying to stretch gently in between. Standing, if you have an ironing board, this is a way that you can try to set up a workstation so that you can stand occasionally. This does go, hopefully you've got one that goes up and down. This isn't maybe a little less expensive than a standing desk. Make sure you're standing on a mat. I don't suggest barefoot like our one lady, but standing on a mat. This is a way you can kind of set up your workstation so that you can stand. Next page. Okay, as far as lighting, watch for glare, especially if you've got windows. Blue light exposure is something that occurs if you're looking at the screen all day. There are some glasses you can get that help reduce blue light exposure. If your lighting isn't right, it's hard to read either the screen or if you're looking at paper. Too much light also has been associated with triggering migraines, and too little gives you eye strain. So lighting is an important thing to think about. Next. So again, if you've got a big window and you've got your office behind, even though it's behind you, that can cause glare on the screen. So we really don't want to have the window behind us or be facing the window. So next slide. You can do task lighting, adding this is a little clip I think I ordered from IKEA that, you can get little task lighting for paper, and this laptop's up on books, or a little lamp to help you see your documents easier. And these are the monitor and lighting. We don't want the window behind us unless you've got blinds. If you can, put some blinds down, because it causes a lot of glare. And also if you're facing the window, see how that contrast between dark and light, this causes a lot of that headaches and things. So what do we want? We want the window to the side. So as best possible, can you try to, and again, have some, maybe it's a little lamp to show on your documents. And that's what we recommend, is if you can try to have the window off to the side. This is a really good thing I recommend even back at the office, is what we call the 20-20-20 rule. So every 20 minutes, if you can look away 20 feet, or it can be 5 feet, but just a longer distance for 20 seconds. So that's actually a couple times an hour. If you want to set a little timer on your phone, if you want to put a banner going across your screen, hey, look up. But just because you're so focused, I don't know about you, I get really focused on my screen, and those muscles in your eyes are working really hard. So just kind of look away, look outside, give yourself a fresh perspective, and do that a couple times an hour just to stretch those eye muscles out. Next. Again, those virtual meetings, please don't sit in front of a window. They're pretty inexpensive. If you really want to get into this, there's a circle light. The other thing is, I saw where they take your smartphone and kind of walk around, look at yourself, and see where the lighting looks best before you do your virtual meetings, and watch your posture, is your double chin showing, or nobody wants to see your nose hairs. Next. Okay, how about children? Some things, maybe pencil grips, something to soften, when they're writing. If you've got young children, especially if they still are working from home, or if they get sent home again, you could take a car seat, put it on their chair to get them up a little bit higher, and use a stool to get their feet not dangling. Use some books, just like we recommended, and also a keyboard that's separated. A little bit of a back support if we have to work in the bed, maybe something to hold them, although I'm not real keen on this neck posture, but task lighting is something to kind of hold that keyboard and make sure they're moving, which I think they're usually moving, but but make sure they're not stuck in these static postures for a long time. Next. Okay, see that these are my little DIY office hacks. If you have an extra sock, I don't know about you, but I have lots of, non-matched socks. As long as they're clean, you can put rice inside of them. If you tie a knot, this can be a little wrist rest by your mouse. If you got a small sock, or a longer one by your keyboard. If you got some Legos, you can build yourself a little pen holder. And finally, if you've got some good solid books, if you haven't used I have my Cooking with Joy book that I haven't used in 15 years. You can use that to elevate your monitors or reams of paper. Okay, so we're going to switch. Be patient with us. We've got a little YouTube video that was put together by BWC. We're going to look at everybody at the one thing first.
So today, because we're all sheltered in place and we're away from our height adjustable workstations and our keyboard trays and our ergonomic chairs, we're going to give you a few pointers on what we can do to relieve those aches and pains when you're sitting at your makeshift work at home office. Your chair obviously is not a properly designed ergonomic chair, but you still want to sit back, have good back support, feet flat on the floor, no pressure under the knee. Placement of your workstation is important for eye stress and strain. You don't want to be facing a window or have your back to the window. Facing the window has a lot of light variations that can cause eye stress. And your back to the window, you can get a lot of reflections on the screen itself. Positioning yourself on the table or changing the table so that you're perpendicular to the light source by 90 degrees is much, much better. Two ways to improve your comfort sitting in your chair. One, obviously, you have to give yourself a little bit of padding. Don't make it too unstable. It should just be minor padding. The other thing is to give yourself lumbar support is very critical. Here I've got a hoodie just draped over the chair. This is a hand towel. Run the hand towel through the pocket, and you've got an adjustable height lumbar support that stays pretty well set. To avoid pressure under the knees that cuts off circulation because your chair is slightly too high, use a ream of paper, a large book, something that gets your feet up off the floor, but yet it's safe. So keep a straight wrist is important and avoid the pressure from the edge of the table. Two things you can do. Find a binder that puts things at the appropriate angle for your keyboard. So even though you're sitting down lower, your wrists are still straight. I've just got a 3-ring binder with paper clips taped on, bent paper clips taped on, and then have a side table for your mouse. You're not reaching, it keeps the shoulders relaxed. To get papers off the desk, come up with your own copy holder. I've got some Legos from the kids, a pad of paper, and a chip clip to make my own copy holder. To avoid the bad posture holding the phone, headphones, earbuds, or if you're blessed to be in a quiet area, use speakerphone. Much better on the neck and the back. With monitor height, the best setup is to move it so that top of the screen is at eye level. It should be about arm's distance away. Depending on your vision, if you've got bifocals, down and low is probably better. Trifocals using the middle limbs, probably higher and farther away. If you've got a laptop, you should always have a monitor with it if possible. If not, you would want to have a separate keyboard at least and use your laptop up at a higher height, more like monitor height. If you're using it as a second monitor, also raise it up, have it up so you can see it just like your main monitor. A lot of us now have been working with sit-stand workstations. This is one option for getting it at home. I've used an ironing board, if any of you remember what those are for. You don't have to worry about wrinkles anymore. I've raised my monitor up on, in this case, encyclopedias. Any large, firm, solid, stable structure would work. Reams of paper, boxes, small tables, something like that. This gets me up, head height for the monitor, keyboard position so my wrists are straight, reverse that binder, mouse right here to the side, I'm ready to go. Think outside the box, but be safe. If you're stacking stuff, make sure they're stable and secure. Avoid trip hazards with wires running all over the place. And definitely avoid electrical hazards. Don't plug one power strip into another. Power strips should go directly into the wall. The most important thing is be flexible and be active. Keep those breaks, even every 6 to 10 minutes, stretching, standing up, sitting down, standing up when you take phone calls. Stay in motion as much as possible. Be safe today.
All right. So a couple slides. I'm going to move so I can see the chat. Next slide. Oh, there we go. See if we can go. I had a couple more. Okay. So did you learn about ergonomic wrists? At least what ones are you going to look for? If you can answer the chat. See if I can see it. And I think I have, so maybe, if you have what wrists you're going to look for, and give them a few minutes. Okay. I saw good info. I don't know if anybody else is looking for wrists, anybody out there. So my next slide, I think, was, you know, oh, you never think about those things in the home setting. Thanks, Amanda. Good info. Always good to remind yourself to stand up every once in a while. Yep. And walk 20, looking away too. Okay. Did you learn any new solutions? Again, is there something you might want to try out? Be creative. I appreciate, yep, be creative. Now everybody's going to have, you know, a sock filled with rice. Yeah, I like the hoodie towel holder, the different positions. Yeah, think about how you're postured. Good. And next slide. I think I got two more maybe. You're going to try any, and then what's the next slide? I think is my, the notebook. Yeah. And then again, if you'd like further information, here's my name. Again, I'm Kelly Ott. Here's my email, kelly.ott.1@bwc.state.oh.us. And you're welcome to call me at 330-323-0030. So if you do want some more information, or if you like that video, I kind of like the little YouTube video, if you want to use that for your own use, you know, at your own employers, or just remind your employees, that's something that's available as well. And if you have any questions, again, put them in the chat. I'll see, you know, I'll try to answer any questions anyone might have. Wow, thanks. Well, if you don't have any questions, I guess we can have Michelle go over like what we're doing for next month. And
Yes. Well, thanks, Kelly, for sharing those tips with us. This presentation has been recorded, so we will put it up on our website for anybody that wants to review it later, or if you want to share it with anybody, sorry, who might find some of these tips helpful and maybe wasn't able to be on today's meeting. We will have it available to review later. Trisha Pycraft from Critchfield and Johnston will be presenting our next meeting on September 22nd. She'll go over some legal questions related to COVID and pandemics, some things related to HIPAA and ADA guidelines and things that people should be keeping in mind during these different times. So registration will be available for that soon, so watch for that. And we will plan to meet again from 11:30 to about 12:30 again next month. So I think that concludes today's meeting, and thank you all for joining us. And hopefully we'll see you all virtually again in September.